Welcome back to Midday Kentucky. Physical therapists do more than rehab injured body parts. Joining me today to discuss physical therapy and how it can improve your life is Dr. Ron. Welcome back to the show.
It's nice to see you again.
Good to see you too. Okay, so what exactly does physical therapists, what are you able to do for people other than the rehabbing after surgery? Because we all know that after a surgery, after, leg or in your arm, shoulder, wherever, you do have to go in for physical therapy. But you guys do more than that, don't you?
We do. And again, surgery kind of being one of those things that people typically think of, but at this time of year, slips and falls with the icy weather, with the cold weather out, is always something that we tend to focus on a lot more because there's a lot more slips and falls now than there is during the summer. Things like arthritis that tend to flare up in the cold months are something that we specialize in treating as well. We can help with that poor diet that you've had over the Christmas holiday if you're like the rest of us and eat a little bit too much junk food.
Maybe just a little bit.
Well, we do in our household. My wife doesn't, but we do completely eat too much junk food.
Well, what can you do to help with all of us that have obviously overdone it over the holidays? What can you do?
Some of the things that PTs are good at doing is tying exercise in with nutritional advice. Helping to help the individual make healthy choices after all the cake and the pie and the junk food that they've eaten, and tie that into a good exercise program in order to help with weight loss and just improve your overall quality of life.
It's so hard. It really is. I mean, even people will see me and they'll see that I'm thin and all of that. Still, my eating choices are always very difficult, and I don't make the right choices in that, and that is a difficult thing. How do you kind of navigate people to go in that better direction?
Well, I'm the same way as you. I mean, I'm a bigger guy and I work out a couple times a week, but my diet is terrible. I love junk food. Twix and Snickers are two of my favorite things. So, and I consciously have to be aware of what I eat as well.
Yeah.
And a lot of that is just evaluating the individual and seeing what it is they're doing, what it is they're not doing, helping them to take a look at the choices of food that they're eating and when they're eating, how often they're eating. All of those play a role into weight loss and into just your overall feeling. And there's a lot of research out there now on this kind of gut-brain connection that's going on.
Yes.
And what you put into your body that then affects the neurology of what goes on in your brain, and that includes pain, well-being, feelings of lethargy, malaise, fatigue, and all these other things.
Right. You had mentioned earlier, you just mentioned pain, and you had mentioned also arthritis. How can physical therapy help with arthritis pain? Right, specifically?
Yeah, absolutely, and especially in the cold months, because everybody who has arthritis or who's been diagnosed with arthritis tends to know that they feel a lot worse when it's cold. Where I grew up in Arizona, everybody was moved out there by their physicians because it was warm weather and it helped them to feel better. So the arthritis flare-ups in cold weather are treated best through exercise, and a lot of people don't want to get out and exercise in the cold.
Exactly.
So in our facility, for instance, we have a heated pool, and a heated pool, getting the individual in the pool and allowing them to exercise in 92 degrees of water helps to reduce that joint pain, allow them to move and to exercise and to feel better without having that increased loading and being outside or exercising in the cold weather. Gotcha,
nice. And can that help reduce medications too, sometimes with patients?
Actually, it can. There's quite a few studies out there looking that exercise, if people were to just exercise and eat right and take care of their weight and their diet, a lot of the prescriptions that are prescribed for various things can be cut in half, if not eliminated.
Isn't that amazing?
Yeah.
Now, what about just feeling tired and lethargic? Do you have any recommendations? Can physical therapy help with that as well?
It can, and the best thing that physical therapy can do for that is evaluating the individual and allowing us to determine an appropriate exercise program to get them independent with a good solid exercise program 4 to 5 times a week, and then allow them to transition that to a gym or a personal trainer or even a home exercise program that they're able to do.
Wow.
Because exercise and movement is life, especially at this time of year.
Absolutely. Well, Dr. Ron, thank you so much for joining us today. It's always good to have you.
Nice to have you. Nice to be here. Thank you.
And after the break, we are back in the kitchen with Miss Allison Davis. Keep it right here on Midday Kentucky.